Medicare doesn't make any sense. So here at Healthcare Solutions Direct, our goal is to make this simple as 1, 2, 3. And where a lot of individuals have problems is understanding the Medigap enrollment period. So we're going to explain that right now. An individual that's eligible for Medicare can sign up for a Medigap supplement plan anytime during the year if they have original Medicare as their primary insurance. So that's the key thing to understand. During the open enrollment period, OEP, or a guaranteed issue period, which was referred to as GI, the insurance companies offering the Medigap supplement plan cannot ask any medical questions. The individual is guaranteed coverage by virtue of just enrolling. We're going to look at both of those two enrollment periods specifically, but if an individual is looking to buy a Medigap supplement plan outside of these two periods, they will need to be what is referred to as underwritten, or UW. Let's now discuss the open enrollment period, OEP. The best time to buy a Medigap supplement policy is going to be during the 6-month Medigap open enrollment period. The individual will typically get the best prices and choices, and guess what? They're automatically approved for the coverage. An individual can purchase any plan that's offered in their state regardless of their health conditions. Many that are eligible for Medicare will find, due to their health, this might be the only time that they can get a Medigap supplement plan. This period starts when the individual is either turning 65 or enrolling for the very first time in Medicare Part B. This period cannot be changed when it starts, and it cannot be duplicated again. See, an individual that's turning 65, regardless if they're eligible for Medicare for the first time or they've been on Medicare early for a disability, can buy any plan that's offered in their state regardless of their health condition. The individual will automatically be approved for the coverage for the Medigap once they enroll into that plan. Now, someone that's picking up their Part B for the first time, for many individuals, the Part B first-time enrollment will actually coincide with them actually turning 65. An individual that decided to delay their Part B when they turn 65 and will now be enrolling into Part B for the very first time through a Medicare Special Enrollment Period, SEP, which we've talked about in a previous video, or a General Enrollment Period, GEP, will also be eligible for a Medigap Open Enrollment Period, OEP. See, any individual that's enrolling into Medicare Part B for the very first time will receive a Medigap Open Enrollment Period, OEP, to purchase a Medigap supplement plan without any medical questions at all. So let's talk about the Medigap Open Enrollment Period so that you have a full understanding of it. The Medigap Open Enrollment Period, OEP, actually lasts for almost a full 12 months. It begins 6 months before the first day of the person's 65th birthday month or the first time they're taking Part B, and lasts for an additional 6 months after that effective date. The individual is given a full year to purchase a Medigap supplement policy without any medical questions or pre-existing conditions taken into consideration. They can make any changes to their Medigap supplement plan anytime during the 6 months prior to their 65th birthday or Part B, or 6 months thereafter. The individual is not required to have their Medicare Part A and B card in place in order to sign up and purchase their Medigap supplement plan. This is very different than those who are looking to purchase a Medicare Advantage plan. With the Medicare Advantage plan, you have to have your Medicare Part A and B card in place in the unique number in order to go ahead and enroll. Medigap supplement plans are very different, where as long as you know you're going to be turning 65 and taking Medicare, or you're picking up your Part B for the very first time, you can enroll into a Medigap supplement plan up to 6 months prior to your effective date. If the individual knows that their Part B effective date will be within the next 6 months, they are allowed to enroll into the Medigap supplement plan. Here's some good news about enrolling into a Medigap supplement plan. An individual that enrolls in a Medigap supplement plan during the Medigap Open Enrollment Period, OEP, that we just discussed does not need to re-enroll into that coverage every single year. The policy can never be canceled by the insurance company for any reason other than for non-payment. The plan will just auto-renew every single month as long as the policyholder pays that monthly premium for that coverage. A great way to think about a Medigap supplement plan, we mentioned this earlier, is if you pay, you stay. If you don't, unfortunately, you won't. So applying for coverage outside of an OEP, an open enrollment period, is not automatic. See, since most health insurance plans today do not take into consideration pre-existing conditions, many are surprised to find out that Medigap supplement companies can still deny coverage outside of the Medigap open enrollment period. We discussed earlier that the private insurance companies that offer Medigap supplement plans currently do not get any financial incentives from the federal government. They must operate with the monthly premium that they are charging for the Medigap supplement plan and assume all risk on their side. The federal government requires, though, that during the Medigap open enrollment period, OEP, the insurance company must offer the coverage without any medical questions. Outside of that period, they are allowed to evaluate the person's health to see if they pose a financial risk to the insurance company. Remember, the goal of every insurance company is to make money. So if you're looking for a Medigap supplement plan, our recommendation here at Healthcare Solutions Direct is to purchase that Medigap supplement plan during your Medigap open enrollment period. If you have any questions at all, please call us here at Healthcare Solutions Direct so that you can talk to one of our licensed insurance agents that can point you in the right direction for exactly what is best for you. If you do not purchase a Medigap supplement plan during your open enrollment period, there might be one other time that you're able to get a Medigap supplement plan without any medical questions, which we're going to discuss now, which is guaranteed issue, which is referred to as GI. See, outside the Medigap open enrollment period, OEP, the other way to get a Medigap supplement guarantee without any medical questions we just referred to is guaranteed issue, and there are 7 guaranteed issue rights that someone who is Medicare eligible will have available to get a Medigap supplement plan without any medical underwriting. So let's go over those right now. There are 4 that are the most commonly used Medigap guaranteed issue rights. The first one, which is the most common, you have a Medicare Advantage plan and you're leaving the Medicare program, or stop servicing your area, or you move out of the plan service area. So example, you have a Medicare Advantage plan in Florida and you're moving to Texas outside of that area, you will be given a guaranteed issue right to purchase a Medigap supplement plan without any medical questions, as well as if the Medicare Advantage plan is no longer offering coverage in your area, again, you will be given a guaranteed issue right to be able to purchase a Medigap supplement plan without any medical questions. The second one is referred to as trial right number 1. A lot of people have this very, very confused. Here's how trial right number 1 works. You joined a Medicare Advantage plan when you were first eligible for Medicare Part A at the age of 65. I'll stop right there because this is where people get really confused. Is you have to have taken your Medicare Part A and B at the age of 65, and within the first 12 months of joining you decide you want to switch back to original Medicare, you will have a guaranteed issue right in order to go ahead and purchase a Medigap supplement plan. So example, you turn 65 years old, you take Medicare A and B as your insurance, but you then purchase a Medicare Advantage plan. You go past the 6 months of your open enrollment period. Those following 6 months, you can still get out of the Medicare Advantage plan and go back to original Medicare and get a guaranteed issue right for a Medigap supplement plan. The next one, number 3, is called trial right number 2. This is very seldomly used. You dropped a Medigap policy to enroll into a Medicare Advantage plan for the very first time, and within the first 12 months of joining, you want to switch back to your Medigap policy. Here's what you would need to do. You must go back to the same company that you left and the exact same plan you had before you joined that Medicare Advantage plan, and that company is required by law to go ahead and give you back your Medigap supplement plan to you within that 12 months of leaving them. Lastly, number 4, you have original Medicare Part A and B as your primary insurance, and you have an employer group health plan including retiree or COBRA coverage that pays after Medicare pays, and that coverage is ending of no fault of your own. This one is very rare now because most group insurance plans are Medicare Advantage plans. Previously, group insurance plans were the secondary insurance to Medicare. There are 3 that are least commonly used Medigap GI rights, so we'll discuss really quickly. Number 5, you have original Medicare Part A and B, and you have a Medigap Select policy. You decide to move out of that plan service area, you're going to be given a guaranteed issue right to go purchase a Medigap supplement plan. Remember, Medigap Select policies are not offered as much anymore, so this is very rarely used. Number 6, your Medigap insurance company goes bankrupt or your Medigap policy coverage ends of no fault of your own. This unfortunately fortunately does not happen anymore. Medigap insurance companies do not go bankrupt, and the Medicare Supplement policies do not end of no fault of your own. So this is very, very rare. The last one, number 7, is another rare one. You request to leave your Medicare Advantage and are granted this request because the company has either not followed the rules or you felt you were misled by marketing materials or the quality or standard of the plan was not satisfactory. There are a lot of things in place right now with marketing rules that make this guaranteed issue right very, very rare. So you must apply as early as 60 days before coverage will end, but no later than 63 calendar days after the coverage ends in order to get a guaranteed issue right. So if you're looking for a guaranteed issue right, you can go ahead and you can apply 60 days prior to that coverage ending, or you'll have another 63 days during an SEP, a special enrollment period, to be able to go ahead and purchase a Medigap supplement plan under a guaranteed issue right without any medical questions. So if you don't have an open enrollment period and you don't have a guaranteed issue period, then the only other way to purchase a Medigap supplement plan would be to be underwritten, which is referred to as UW. An individual can apply for a Medigap supplement plan anytime during the calendar year. Remember, if they have original Medicare or they're during their open enrollment period, OEP, that runs from October 15th through December 7th. So in order to apply for Medigap, there is no need for a physical in order to qualify. A lot of people have this misunderstood. You do not have to have a physical in order to qualify for a Medigap supplement plan. The individual just needs to complete a short medical questionnaire over the phone. If you're looking to go ahead and apply for a Medigap supplement plan, we encourage you to call us here at Healthcare Solutions Direct so that we can look at your health condition to see if maybe A, we can save you some money on your current Medigap supplement plan, or if you're looking to get out of a Medicare Advantage plan during a special time during the year, we can also look at those options as well. There are general questions for an individual to consider that needs to be medically underwritten for a Medigap plan that we're going to go over right now together. So basic questions to consider for Medigap approval if you need to be underwritten. Number 1, how is your current health? Is it okay? Is it bad? What type of health issues do you have right now? Secondly, do you have any pending medical treatment that's been advised or not yet scheduled? Is that a yes or a no? If there's something that's been advised or has not yet been scheduled that's been recommended, unfortunately that would be a decline with a Medigap supplement policy. But please call us so that we can talk about that to make sure that that's the case for you. When is your next doctor's appointment? What is it actually for? Again, these are questions that we will discuss with you. A licensed insurance agent will talk to you about this. So an example of a decline. So let me give you an example of a decline. You're advised to see a dermatologist to remove basal cell from your face. Or you have an appointment to see a doctor because your knee is hurting you. Or you have a scheduled cataract surgery. Or you need to have physical therapy. Those appointments must be completed before submitting an application. So if you have any of those appointments that still need to be done, those would need to be completed before applying for a Medigap supplement policy. But if you have any questions about that, please again give us a call so we can talk to you about that to make sure that that's the case for you. An example that's okay, if you have an annual mammogram or annual wellness physical, a routine semi-annual visit for, say, cancer or heart attack checkups after 2 years of remission, those will be viewed as preventative care if there's no complications. So again, there are certain things where you will have doctor visits that you'll need to go to that are still okay to apply for a Medigap supplement plan. Just give us a call so that we can go over that with you. How many medications are you taking and what are they for? So again, an example would be if you're only taking 2 to 4 medications, which is normal for preventative, that could be okay. An example of some caution would be 5 or more medications. That might require us to look a little bit further to find out what those medications are for so we can advise you what companies will accept that. An example of a decline, narcotics like Vicodin, Percocet, oxycodone, etc. If they're filled more than once in 6 months, unfortunately most insurance companies will decline that coverage for a Medigap supplement plan. Some other things to consider when it comes to applying for Medigap supplement plans. Diabetes is the most common reason that we see here at Healthcare Solutions Direct of why someone actually gets declined. So the question we would ask is, do you have diabetes or been diagnosed as pre-diabetic? See, diabetes is not an auto decline, but if the answer is yes to any of the following 4 questions, the individual unfortunately would not qualify typically for coverage under most Medigap supplement plans. But again, I say most, there are some certain situations which might allow that individual to still be able to get coverage. Again, please give us a call so we can take a look at that. So the question we would always ask is, have you ever in your lifetime had any heart issues? For example, heart attack, stent placement, or diagnosed with congestive heart, or diagnosed with AFib. So if you have had any heart issues in the past along with diabetes, unfortunately that's going to be very tough in order to get approved for a Medigap supplement plan. The other question that we ask is, have you ever had a stroke or a TI mini stroke in your lifetime? If you ever had a stroke or a TI mini stroke and you have diabetes or been pre-diabetic, unfortunately that's going to be a very, very tough thing in order to get approved through the Medigap supplement company. Another question we ask is, have you ever been diagnosed with neuropathy or retinopathy? That's when there's tingling in the hands or the feet when it comes to diabetes. That's another issue that's very, very tough to get approved by Medigap supplement companies. But again, we'll go over that with you to see exactly what your best option is. And then lastly, are you prescribed or taking gabapentin or Lyrica? A lot of individuals don't know that gabapentin or Lyrica are associated with neuropathy or retinopathy. Another issue that Medigap supplement companies will look at is this, is that some companies will be very strict about the combination of blood pressure medication and diabetic medication. Again, that's not a decline with all insurance companies, but that's something that they evaluate very, very closely. Again, please give us a call so that we can go ahead and we can look at your particular situation so we can best advise you on exactly what direction to go to. Any major issues, unfortunately, will not be accepted by most Medigap companies. So let me give you some examples. In the last 2 years, 24 months, if you've experienced any major issues like a heart attack or heart issues, stent placement, stroke, internal cancer other than for basal cell or squamous cell, most Medigap supplement companies unfortunately will decline for those conditions. Other major issues in an individual's lifetime would be something like COPD, congestive obstructive pulmonary disease, kidney disease, Parkinson's disease, Lou Gehrig's disease, ALS, hepatitis, cirrhosis, Alzheimer's disease, currently using oxygen or nebulizer, diagnosed with major depression. Anxiety and depression are okay, but bipolar or schizophrenia or major depression are something that insurance companies look very, very closely at. Again, when it comes down to underwritten applications, we've gone over some information on what to look for when you're applying for a Medigap supplement plan. But please give us a call here at Healthcare Solutions Direct so that we can look at your specific situation, because there might be some things that are available to you that we can recommend when it comes down to the Medigap supplement plan. We definitely look forward to helping you, look forward to talking to you, and definitely look forward to helping you as well.